Complex care is really about taking an individualized approach to each patient and meeting them where they're at, understanding where their goals are, and how we're gonna get there. So really thinking about each player that's involved in this patient's care, what is the goal from that system, and how do we put these pieces together? We all know that some of our patients at Gillette have specialists spread across many different systems. How do we get them to talk well together? What do we do when one specialist is telling you one thing, another specialist is telling you a different thing, and they seem to kind of butt heads? That's where complex care comes in, is to say, okay, we need to take a step back. What's our goal? And how can we bridge the communication and the gap in the thought process to figure out what's the right way forward for this patient? I grew up in Baxter, Brainerd, Minnesota, a small town about 2.5 hours north of the Twin Cities here. And when I was looking for a job and as I was going through my training, one of the things that was important to me was understanding how we can bridge the gap between rural versus urban medical care. So certainly we know patients that are born or grow up in greater Minnesota or the Dakotas, in these rural places, don't have the same access as a patient that lives here in St. Paul. So it was really important to me to be able to give back to the community that I grew up in, to make sure that patients and kids that are born there with complex medical conditions can stay there and still continue to get high quality care.